evolving.
Oh, for sure. Always something new on the horizon.
Well, that's exciting. Okay, we've covered pre-prosthetic surgery, implantology. Now let's talk about that orthognathic surgery you mentioned. That sounds pretty intense. What's that all about?
Orthognathic surgery, sometimes called corrective jaw surgery, it's all about fixing irregularities in the jaw bones and getting that bite aligned properly. Could be caused by genetics or developmental issues, sometimes even trauma.
So it's not just about looks, it's about making sure the jaw works right.
Absolutely. If your jaws are misaligned, it can affect how you chew, how you speak, how you breathe, even how you sleep. Orthognathic surgery, it aims to correct all that, get those jaw bones in the right position.
I bet that's a pretty involved procedure.
It can be. Different techniques depending on the problem. Sometimes we do what's called the Lefort osteotomy. That's where we cut and reposition the upper jaw. Or a sagittal split ramus osteotomy for the lower jaw.
Sounds complicated. And the recovery, that must be a long process.
It takes time, that's for sure. But it's gotten a lot more manageable, with better techniques and pain management. We use plates, screws, wires to hold everything in place. Sometimes patients need braces, too, before and after surgery, just to make sure the teeth line up perfectly.
Wow, it's amazing what oral surgeons can do. So we've touched on pre-prosthetic surgery, implants, orthognathic surgery. Any other cool new developments or trends in this field that you want to talk about?
One thing that's really exciting is this push towards minimally invasive techniques, like we talked about earlier, smaller incisions, special instruments, using computers to guide the surgery, all about minimizing trauma and speeding up healing.
Less pain, faster recovery, fewer complications. It sounds like a win-win for patients.
Exactly. And we're using these techniques for more and more things, from taking out wisdom teeth to even some jaw surgeries.
That's awesome. It really is amazing how much things have advanced. I'm starting to see why you're so passionate about this field.
It's pretty incredible, isn't it? There's always something new to learn, something new to try, and it's all about helping people feel better, function better.
Well, I think we've given our listeners a lot to chew on. But before we wrap up, I want to touch on one more thing that seems really important. Managing those medically compromised patients. That must bring a whole other set of challenges.
It does. We get a lot of patients who have other health conditions, things like heart disease, diabetes, bleeding disorders, weakened immune systems. It's something we always have to be mindful of.
So you're not just thinking about the surgery itself, but their overall health, too.
Exactly. We have to really dig into their medical history, what medications they're on, their current health status, make sure we're choosing the safest and most effective approach for them. Sometimes we even need to talk with their primary care doctor or other specialists.
Sounds like a lot to juggle.
It can be, but it's so important to keep those patients safe.
I hear that. Well, I think we've covered a lot of ground in this deep dive, from the basics of oral surgery to some pretty cutting-edge advancements.
We have, and I think one of the big takeaways is that this goes way beyond just teeth. We're talking about the whole head and face area and how important it is for people to be able to function normally and, feel good about how they look.
Absolutely. And with technology always moving forward, who knows what's next? It's an exciting time to be in this field, that's for sure.
It is. There are so many possibilities.
Well, join us for part 3, where we'll wrap things up by talking about the changing role of oral surgeons in healthcare and what the future might hold for this amazing specialty. Welcome back to our final segment. I feel like we've gone deep into the world of oral and maxillofacial surgery.
We have, and it's definitely more than just, dentistry plus. It's a real blend of surgery, medicine, even a little bit of artistry.
I was just thinking that. So looking ahead, where do you see this specialty fitting into the bigger picture of healthcare? Any big changes on the horizon?
Oh, yeah, definitely. One thing that's becoming more and more important is interdisciplinary care. Oral surgeons working hand in hand with other specialists like oncologists, sleep doctors, reconstructive surgeons.
So less working in silos and more like teamwork.
Exactly. Think about oral cancer, for example. Before, the oral surgeon might have just been involved in the biopsy and, removing the tumor. But now they're working with oncologists throughout the whole process, from diagnosis to reconstruction to, long-term care.
Makes sense. Patients must benefit from that kind of collaborative approach.
Absolutely. You're combining all this expertise so you can provide truly personalized care. And I think this is only going to become more common, as we learn more about how oral health and overall health are connected.
Speaking of, you mentioned before the challenges of treating medically compromised patients. Any other big challenges you see for this field in the future?
Well, one thing that comes to mind is keeping up with technology. Things are changing so fast, new imaging techniques, surgical tools,
But
biomaterials.
you got to be a lifelong learner, always staying on top of the latest and greatest.
No doubt about it. And it's not just about learning the new stuff, it's about, really evaluating it. Does this new technology actually benefit the patient? Or is it just, hype?
Right, right. Can just jump on every bandwagon that comes along.
Exactly. It's about providing the best possible care. And that means being thoughtful, staying informed.
Okay, so challenges aside, what are you most excited about for the future of oral and maxillofacial surgery?
What really gets me excited is the potential of regenerative medicine and tissue engineering. We're starting to see some amazing results with stem cells and growth factors actually regenerating bone and soft tissues.
So, like, instead of using grafts or synthetic materials, you could actually rebuild a jawbone using the patient's own cells.
That's the dream. And I think it's getting closer. Think about what that could mean for, jaw defects, facial trauma, even oral cancer. Could really change everything.
That's amazing. I think we've really done this topic justice. From simple extractions to, like, the future of regenerative medicine, it's been quite a journey.
It has. Hopefully our listeners have a new appreciation for this specialty.
I'm sure they do. It's a field that takes a lot of skill and precision and, a real dedication to helping people.
It does, and it's always evolving, always pushing the limits of what's possible.
Well, thank you so much for sharing your expertise with us today. It's been a real eye-opener.
My pleasure. I love talking about this stuff.
And to our listeners, thank you for joining us on this deep dive. Until next time, keep those minds curious, and remember, a healthy smile is a beautiful thing.